Hi everyone, it's Dr. Charmaine Johnson again from Premier Smile Center, and today I'm going to talk about bad breath. It's one of those topics that we all worry about. It's called halitosis, that we have anxiety about, and that's why our grocery store shelves are filled with mouthwashes, toothpastes, mints, gum, all these different things, sprays that help us try and eliminate bad breath. Unfortunately, those things are a temporary measure, and after half an hour at most, we're going to find that we have bad breath come back again. So the question is, what causes bad breath, and what can we do to try and eliminate it or decrease the occurrence of it? First thing is food. So the foods that you eat can play a part. Garlic, onions, spices, that stays, it gets emitted from the lungs within up to about 24 hours of you eating it. At the same time, food particles that are left in the mouth, like in between your teeth, things like that, bacteria sits on that, it eats it, and it creates a bad odor or smell. From that process, it actually breaks down and it emits a sulfur compound, which is that smell you smell when you have rotten eggs. So food is one of them. The second thing is obviously smoking tobacco products. That leaves that typical smell that you see from smokers. Poor dental hygiene. You know, I go over this over and over again, but like I said, with bacteria sitting on all the food particles in your mouth and not being able to remove that effectively, especially in between the teeth. So using something that works in between the teeth, like little bottle brushes, floss, water pick, just anything to get in between the teeth, because most of us floss twice a day. That's not the issue. It's just getting the stuff out from in between the teeth that's going to be an issue. Dry mouth. More and more people are developing dry mouth because we're taking a lot more medication, and interaction of the medications affects the salivary flow. A lot of people are living for longer, and so we're combating things like different cancers, and so there's a lot of chemotherapy, radiation therapy that when it's near the head and neck can actually destroy and damage the salivary glands, and so we have reduced amount of salivary flow. So dry mouth is a problem. Certain medications we take can actually cause that as well. Infections in your mouth are a big thing. So surgical wounds, if you've had a tooth extracted, is something. Infection of your gums, gum disease, or what we call periodontal disease, has a very specific odor that we can pick up easily as a dentist, that is from advanced gum disease, and that can cause bad breath. A lot of the bacteria is sitting deep down in the pockets around the teeth, and it's hard to remove from just regular brushing and flossing. Other things can be, nose and throat conditions. Tonsillitis are basically food particles or stones that get caught in the tonsils, in the crypts of the tonsils, and they sit there for days, weeks, months, even for some people, before they get bigger and bigger, and then you cough or you sneeze or something and it comes out. So that can cause bad breath as well. And then lastly, some of the other things are like acid reflux and certain cancers. So those are the causes of it. What do we do to try and eliminate it? So number one, different foods, garlic, onions, that type of thing. Obviously reduce your intake of that because like I said, it can stay up to 24 hours where it gets emitted through your lungs. From a dental perspective, one of the biggest things is the bacterial accumulation on your tongue. So your tongue has these little papilla, like these little fingers or projections off the tongue, and it's like your skin. Eating, chewing, the initial layer, like your skin cells, gets sloughed off or removed, and if it collects a lot, and that dead cells on the top of those little projections collects and thickens, it obviously collects bacteria as well. And it sits in there and it breaks down the food particles, and you get the sulfur smell that gets emitted. So what we suggest is you use a tongue scraper every morning, and you literally scrape the tongue to remove those dead cells. A toothbrush is not as good because it's like using a broom on a shag carpet. You're just kind of brushing it along, but you're not actually removing it. So definitely a tongue scraper is by far much more important. In terms of taking care of gum disease, obviously your usual excellent good hygiene at home is key, but visiting your dentist, making sure that every 3, 4, 6 months your hygienist is cleaning underneath those pockets to remove the bacteria that you're not able to keep out of there, because we're not perfect, you know, we always leave stuff in there and we're never going to get everything out. But over a 3, 4, 6 month time period, when it collects underneath there and becomes hard tartar where you can't brush it off anymore, then our hygienist can help you remove that stuff and keep you healthy again. So evaluating for gum disease is key. And then mouthwashes, mints and that type of thing, obviously, you know, use those just as a temporary measure to help with that. Mouthwashes that have a zinc component in are seem to last a bit longer in terms of its effects. So something like Smart Mouth is a type of mouthwash you can use. And the one thing I want to warn you about is that mints in the gum. Just be careful of the types of sugars that are in there. Xylitol is a sugar that we want to make sure we have in those products, because it's a type of sugar that gives us the sweetness, but it's the one type of sugar that bacteria will ingest, but it can't break it down, so it literally starves the bacteria, and then, you know, it dies. And so you want to be careful that you don't have the other sugars that will increase the chances of not gum disease, but cavities, and all of a sudden now you have a whole bunch of cavities. So look for gum and mints that have xylitol in it, because that really is